We now cross over to the Radisson Blu, where there is the official launch of the Eastern Africa Regional Collaborating Center, or the CDC, and the Commission has supported the fight against the pandemic with the deployment of over 4,000 community health workers and also scaled up testing capacity when it matters COVID. But I can see our reporter Purity Museo is on standby to give us more on that development. Purity?
A very good afternoon to you, Njue. We are coming to you live from Arboretum right here at the Radisson Blu Hotel, where the launch of the Regional Collaborating Center, EARCC, is officially happening here. And of course, some of the representatives come from the Center for Disease Control Africa, ministers of health from different regions, Tanzania and Kenya, of course, and Uganda. And the reason that this center is being launched here is to just ensure that some of the things that will be addressed is to support the region, the East African region, in terms of the response to some of the diseases. And it's coming, Joy, at a time when the World Health Organization did release a report that only 15 African countries have been able to hit its target of ensuring that at least 10% of the population of any country's population is vaccinated by the end of September. And Kenya is among the countries that are yet to hit this target, having vaccinated only 4%. Before we proceed much, let's speak with the regional coordinator for this center that is aimed to, or that is said to be, hosted or held here in Kenya, and the region will be based here in Kenya, to just get to understand what the Center for Disease Control is doing, especially at this time where Africa is struggling with deployment of vaccines. Thank you so much for joining us. Maybe you can just quickly tell us, today we are launching this Regional Collaborating Center, what it means for the East African region. Just come closer, please.
Thank you. Thank you. Today, it's a very exciting moment as we are launching the Eastern Africa Regional Collaborative Center, African CDC. Our governments and head of states, considering the health challenge in the continent, they have endorsed the establishment of Africa CDC in their assembly in 2015. And Africa CDC was established in January 2017. And regional, so the head of states also endorsed in the statute the establishment of regional coordinating centers. So this, in fact, the very basic principle of having the regional coordinating center is coordinating health activities, health challenges in the region. It is to create Africa CDC without walls. When the support is acquired at a time of need immediately.
And what are some of the issues that will be that you look at addressing first? We know health issues that you look at addressing first once this center is officially established.
Yeah. So Africa CDC and the Regional Coordinating Center, the objective of it is enhancing the capabilities of the member states in terms of detection, and if you detect early, in terms of prevention, and also early intervention and treatment. So basically, it is to enhance the capacities and the capabilities of the member states to immediately respond. Because whenever something happens, an infectious disease or a disease threat happens, immediate response is with them. So it is building up the local capabilities. And not only that, as we have seen, diseases do not have boundaries. So what's happening here today in Nairobi would happen tomorrow in Ethiopia, in Uganda, in Tanzania. We have learned a lot during COVID pandemic. So we also need to coordinate, to partnership, and use the available public health assets, and so these are the mechanisms or the approach for the regional coordinating centers.
And this launch is coming at a time, the World Health Organization did release a report that only 15 out of the 54 African countries have been able to vaccinate at least 10% of their population. Maybe what are some of the challenges that are facing COVID-19 deployment in Africa?
Yeah, we have learned a lot during this COVID-19 pandemic. African countries, African member states coming up together and fighting against the pandemic. So at the end of the day, the solution is in our hands. We need to put our efforts together. As you know, even for vaccine availability, even when you have the money, the availability of the vaccine is also an issue. So it's up to the continent now. So, for example, the African member states and through Africa CDC is also facilitating the availability of vaccine to member states through various mechanisms. So it's very, very important for African member states to come together to have our own solutions. Just to be cited as an example is recently countries have put their own funds and vaccines are being distributed to African member states.
And as the coordinator for the East Africa, maybe what are we looking at? Because we are hugely affected. Most of the East African countries have not vaccinated up to this 10%. With the launch of this region or this center, what are some of the efforts that we are going to see to ensure that we hit this target and the next target that the World Health Organization is going to put for countries and ensure that we vaccinate as many people as possible?
Yeah. The launch of the Regional Coordinating Center is one very important milestone because it brings about visibility to the Regional Collaborative Coordinating Center, and it creates a platform of more partnership, more coordination, and also more commitment. As you have seen, the health, our excellencies health ministers in the region, and also it's a hybrid launch program, in person and physical, and also other ministers of livestock, agriculture, environment, and also academic institutions and centers of excellences, regional economic communities, and also all development and health partners are talking together. So coordination and partnership would bring about more response and better and effective response.
Thank you so much. Thank you so much.
Thank you.
Thank you. We do appreciate. Njue, that has been Dr. Cham, and she is the coordinator for the East African Regional Collaborating Center that is set, officially launched, but it will be based here in Nairobi, and it's just support the countries, especially into the response and prevention of some of the diseases. And we are talking about COVID-19, and Kenya is among the 50 countries that have missed out on the 10% vaccination target that was set by the World Health Organization, and only 15 countries in Africa have been able to vaccinate over 10% of their population, and therefore if it's 50 countries are yet to vaccinate, then that means that 35 of most of them are from the African region. So we are just going to see what are some of the efforts they are going to put and ensure that vaccination drive is ramped up, especially in Africa. And of course, they are challenging African countries to also try and see if they can manufacture COVID-19 vaccines so as to address the issue of inequality as far as accessibility to these jabs is concerned. That's it from us. I'm Purity Museo. It's back to you, Ben Troy, in studio.